Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about a situation whereby some people think that once they have a chronic disease or they have a chronic infection, it means that the need for prevention has come to an end. So to them, the purpose of prevention is to make sure that you don't get to have a certain disease or infection. So that once you get to have that disease, you get to have some hypertension or diabetes or a chronic infection like hepatitis B, it means that prevention has come to an end. Okay? But that is not how we usually think when it comes to health. Our thinking when it comes to health is that no matter your state of health, there is always a possibility of an outcome worse than your current state. So it means that there's always something to prevent. Okay? So if you have hypertension, you have diabetes, we know that the outcome of hypertension and or diabetes could be a stroke, could be a heart disease, could be a kidney failure, and so on. So then, we cannot say that we have nothing to prevent if you have diabetes or hypertension. We have a stroke to prevent. We have a heart disease to prevent. We have a kidney failure to prevent. Okay? So, all the time, our thinking is that it does not matter your current state of health. There is always a worse outcome to prevent. That is why when we talk about prevention in health, we talk about 5 levels of prevention. Okay? The first level of prevention is what we call primordial level of prevention. Now, if you take hypertension or diabetes, we know that there are some lifestyle factors, okay, that can lead to diabetes or hypertension. Smoking, alcohol misuse, inactivity, or what we call lack of exercise. Then inappropriate diet, okay. These lifestyle factors can lead to diabetes and or hypertension. So with primordial prevention, the goal is that we don't want you to get to be exposed to these lifestyle factors. Okay, so there are interventions put in place that are usually beyond you. So maybe a government puts in place some environmental intervention, puts in place some social, economic, or some interventions to make sure that risk factors of a disease, okay, do not come close to you, or you are not exposed to factors that lead to a certain disease. In primordial prevention, a government can put a ban on importation of alcohol, or can increase tax on these products so that it is difficult to have to access them financially because they are expensive. Or a government can put a ban on the importation of products that contain some high calorie content, high sugar content, high salt content, okay, just so that people are not exposed to the risk of not eating appropriately. A government can put in place, when constructing roads, can put in place walkways, pedestrian walkways, or let's say cycle lanes to encourage people cycling, because cycling is a form of exercise, or walking. Pedestrians will walk instead of picking vehicles because they are pedestrian walkways to encourage increase in activity or exercise on a population. Now, with primordial prevention, if you take a pandemic, for instance, let's say COVID-19 pandemic, a primordial prevention would be to close your borders to countries that have the infection so that the infection is not imported into your country. Okay, so that's what we call primordial prevention. Now, beyond primordial prevention is what we call primary prevention. That means that now the virus, the COVID virus, for instance, has come into your country. Okay, the infection used to be in someone's country, it was not in your country. So we are closing borders. Okay, by this time the infection is in your country, it's close to you. So you have to practice the protocols, hand hygiene, wearing of face mask, social distancing, and so on. Okay, that is primary prevention. So in primary prevention, the cigarettes are around you, okay? So the government has not banned importation of cigarettes. They are around you. The alcohol is all over the place. There are junk foods all over the place in the markets. Okay, primary prevention, you put in place lifestyle measures to make sure that the risk factors that you are exposed to, they do not lead to any disease in you. Okay, because you are putting in measures to avoid these risk factors. All right. Now, another important component of primary prevention is immunization. So you get yourself immunized or vaccinated is also an important aspect of primary prevention. So at this time, you don't yet have the hypertension. Okay, primordial prevention, you don't have hypertension, diabetes yet, and you are not exposed to the risk factors at all. Primary prevention, you are exposed to the risk factors, but you don't yet have the hypertension or diabetes. Okay, now when you get to have hypertension or diabetes, for instance, then we say that primary prevention has come to an end because you already have the disease. All right, so then we initiate what is called secondary prevention. And secondary prevention has to do with early detection of disease and managing them early enough. Okay, and the goal is to prevent some complications, prevent worse outcomes. All right, in secondary prevention. Okay, so in secondary prevention, it involves screening. So we do a lot of screening in secondary prevention, okay, to detect diseases early and manage. So it is not the case that you have hypertension, you have diabetes, there's nothing more to prevent. We can do what we call secondary prevention because there are worse outcomes like a stroke, like a heart disease, like a kidney failure, that are complications of diabetes and or hypertension. Okay, so we can initiate the process of secondary prevention to prevent these worst outcomes. All right, that may require you to be on some medication, on diabetes medication or hypertension medication to normalize your blood sugar, to normalize your blood pressure. We also add lifestyle modification to as an adjunct to this drug management as well, okay, in order to prevent these complications. Now, if you get to have now these complications, you get to have the stroke, you get to have the heart attack, you get to have the kidney failure, even that, there is still something to prevent. All right, because you see, you have survived the stroke, you have survived the heart attack. Okay, you can prevent worse outcomes of a heart disease, you can prevent further disabilities from a stroke. So there is always something to prevent, even in tertiary prevention. In this case, we are preventing poor quality of life, reducing disability, preventing frequent visits to the hospital because of an emergency, and also preventing or delaying ultimately deaths. We call that tertiary prevention. Okay. Then we have a fifth level of prevention we call quaternary level of prevention. Now, we know that because there's so much proliferation of medical products, medical procedures, there is the danger of over medicalization of patients or over commercialization of healthcare products. So there should be a system in place to make sure that the patient is protected, okay, in such a way that the patient will have value for his or her money as far as healthcare is concerned, and the benefits of the healthcare services that the patient receives or the medications that the patient receives, the benefits outweigh the risks of the treatments or the procedures that we do for the patients. So with quaternary prevention, okay, we are making sure that the patient is always protected from over commercialization of healthcare services, over medicalization of the patient, and all the time there's always benefits to the patient as against the risks that this healthcare interventions can bring to the patient. Okay, so we used to have three levels of prevention: primary, secondary, tertiary. Okay, but these days we have added primordial prevention and quaternary prevention because they are necessary to improve human well-being. All right, now so what is the take-home mainly in this video? The take-home is that it does not matter your state of health, there's always a preventive strategy that needs to be put in place, because there are levels of prevention. Primordial prevention is at a level that you don't yet have the disease and you are not involved. Primary prevention, you are exposed to risk factors. Unlike primordial prevention, you are not exposed to risk factors, but you are exposed to risk factors, and you must adopt lifestyle changes to make sure that you don't get to have a disease. In secondary prevention, you have the disease, but in a milder form, okay? But you don't yet have complications of the disease. In tertiary prevention, you have a complication of a disease, but there's always something to be done to prevent worse outcomes, or to reduce disability, to improve quality of life, and to delay deaths or to prevent deaths. Okay, in tertiary prevention. And in quaternary prevention, we are making sure that the many medications and medical procedures that we are exposed to, they benefit you. They don't bring you harm, they rather benefit you. Okay, it's a way of protecting you. All right. So all the time, no matter the state of health in which you find yourself in, there's always the opportunity to prevent worse outcomes. Okay, so you don't give up and say that, well, once I have a disease or I have an infection, nothing more could be done. It is not true. If you understand the levels of prevention, you realize that there is always something to be done to prevent a worse outcome, and ultimately to delay or to prevent death. Okay, thank you very much for watching this video, and subscribe to my channel. Thank you.